Hi, my name is Susan Ficino. I'm 54 years old, and I was diagnosed with osteoporosis, severe osteoporosis at the age of 47. I was a teacher, an elementary teacher my entire life. I taught kindergarten and fourth grade. I was very active. I had a daughter. I still have a daughter. She's 27 now, but at the time she was younger, and we went to sporting events, dance competitions, you name it. Was very active. I had no history of osteoporosis in my family, none whatsoever. I just kept starting to complain of back pain, like my back hurt. And I thought it was because I was on the floor with my kindergartners, being active. So I started to buy special shoes, thinking that would help. And I literally got to the point where I couldn't even stand up one day. And I actually never returned to teaching from that day on. I was sent for an x-ray at my request, and the x-ray came back and it showed 7 compression fractures in my spine. And of course, the first thing I did was Google compression fractures, and it showed that compression fractures are linked to osteoporosis. And I thought, how in the world could I have osteoporosis? I'm not an old lady, because you typically think it's an old person's disease. Um, I kind of really wasn't getting much answer. Like nobody suggested at this time a brace, nothing. They were just like, well, go to a pain clinic. And of course I did, and they gave me any kind of pain pill that I wanted, but it was not fixing the problem. It wasn't helping at all. So after about 4 months of living in severe pain, 1 compression fracture would have been bad enough, but 7 was just debilitating. I can't even express that enough because I'm doing so well now, but I couldn't walk. I couldn't bathe. I couldn't make it up my steps. My daughter would come and help me like get a shower every other day. Um, so fast forward, I told my husband one day that August, I said, I want you to drive me to Pittsburgh, which is about 2 hours away from my hometown. And I want you to take me to Allegheny General Hospital. And at least if I go there, I feel like I'm going to be able to see different doctors, like an ortho doctor or a neurosurgeon or someone that can tell me something. I just felt helpless. I didn't know what to do. I had no direction. So my husband got in the car with me. It was a painful ride, 2 hours away, but when we went there, they did x-rays and CAT scans, and it confirmed the compression fractures. But they had me meet with an ortho doctor who literally had a brace fitter person come in, fit me in a brace that at least held me in and was supportive so that I wasn't like a wobbling tower with all these broken bones. And they suggested that I contact like a neurosurgeon and an endocrinologist. So when I left there that day in August, I felt like I had a bit of a direction. Um, I ended up seeing a great endocrinologist who was more than an endocrinologist to me. He was very, very up to date with things. He listened to my concerns. He listened to me cry about my pain that I was in. And he did lots of lab work. The lab work came back showing that I had high blood calcium. So I had parathyroid tumors, which apparently were taking calcium from my bones, putting it in my blood. But I would have never known this if I wouldn't had lab work. I also went through some tests prior to this, and I was misdiagnosed with lupus and put on a very high dose of steroids. And I had a hysterectomy about 8 years prior to this diagnosis. So I had many factors contributing to my osteoporosis diagnosis. And no matter what the cause, the bottom line was I needed help and I needed help as quick as possible. So this endocrinologist, he knew the damage was done. My life was changed. I had to retire quickly. And he suggested that I try a special medicine. He sent me to a parathyroid specialist. I had surgery at the Cleveland Clinic. My calcium levels were normal. And during that time, I was still living with severe pain, and I have tried anything and everything for the pain. I've done acupuncture. We bought a therapy pool for my basement that's very, very warm water that I can go in to get some relief. I tried acupuncture, massage, muscle relaxers. So um, I just feel like it's so important for anyone in the medical profession to realize a lot of people don't know these things. Like, I had no idea what osteoporosis really was. I thought that it was an old person's disease. And I never thought ever that at age 47 it would be possible for me to have compression fractures related to osteoporosis. I was on that medicine for a year, and my bone growth was significant. Um, I'm still in the osteoporosis range, but it's better than it was. It's been 7 years now, and I have been through years of physical therapy. Um, the physical therapy is helping. It's not a cure-all, but it has helped me so much more function in life. There were many days where literally all I do is lay there on heating pads, and I would start to try to build up being able to walk little bits at a time. I think what would have really helped me initially is if just a family doctor, a local doctor would have pointed me in the right direction. I really wasn't getting answers other than you have compression fractures due to osteoporosis. That wasn't really helping to solve my problem at the time. My problem at the time was severe pain and not being able to function. Um, I wish doctors would educate their patients more, make them more aware. And I realize doctors, especially a family doctor, you're seeing so many different issues in a day's time, so many different problems. But in regards to osteoporosis, if you're able to be proactive in any way and preventative in any way, that would be so much better than in what happened with my case. I had the 7 compression fractures which actually turned into 11 before it was all said and done. And so I feel like in my situation, it was like trying to patch it. Like, here's some medicine to make your bones stronger now. But I had already shrunk 2 inches and was experiencing all of this pain. So I feel like doctors, nurse practitioners, that they just need to be more aware that it is a possibility that someone my age could be diagnosed with osteoporosis. And another factor, and I know this is probably um, above what they are allowed to do, but I strongly feel that DEXA scans should be given way before the age of 65. Most women do not know that they have osteoporosis until diagnosed with a compression fracture, I have learned. So I know that a medical association sets those standards, but I feel like maybe doctors need to get it out there that women need to be checked for this, need to be screened for this at a younger age. In my case, with having a hysterectomy around the age of 40, like, I feel like there should have been some type of baseline then, at least to let me know, okay, here's where you are, and maybe check me 3 to 4 years later. Um, Checking me at age 47, once I had the compression fractures, the damage was done. So there wasn't any preventative we can do. We just tried to stop any future fractures from occurring. Currently, I still go to physical therapy 2 days a week, and they work with me on strengthening other parts of my body to try to alleviate some of the pain in my back. I still, by midday and late afternoon, I'm still in a lot of pain, having to lay on heating pads. But the physical therapist has really worked with me to teach me different types of stretches to try to alleviate pain. I try to be as active as I can each day. I try to go for walks each day. Um, I'm definitely better than I was when I was initially diagnosed 7 years ago, and I'm very thankful for that.